Respiratory Issues by Josie Poehler and Julia Forster. In the Pediatric Pulmonology Journal, a clinical investigation of respiratory system admittance in preschool children was analyzed. In young children, respiratory function is measured by a forced oscillation technique, FOT, which is shown in the picture to the right, and measures respiratory mechanics. These changes throughout the respiratory system are referred to as ARS, respiratory system admittance, and are independent to the shunt of the upper airway. To study this, the question of how the ARS stability to the outcomes of standard oscillatory effects respiratory disease was posed. Researchers hypothesized that ARS changes can increase the sensitivity of detecting and deciphering bronchodilator responses when compared to FOT variables. It was also predicted that the use of ARS would increase the sensitivity of the FOT method, and they expected the ARS to be smaller than the ZRS when ZRS were increased. 158 healthy subjects, being without asthma, ranging from ages 4 to 6, were chosen to establish baseline data. Each of these 158 subjects were treated with measurements of respiratory system impedance, known as ZRS. Out of the 158 subjects, 123 were used to measure the repeatability of changes in respiratory system admittance. Another treatment including healthy children and children with respiratory diseases limited to cystic fibrosis, asthma, and wheezing was established. To perform this, it was necessary to have salbutamol. The children inhaled the salbutamol in order to compare ARS and changes in XRS and ARS to assess the bronchodilator response in healthy and unhealthy children. For the next treatment, it was necessary to attain saline and AMP to test the adenosine 50 monophosphate AMP challenge. 18 children inhaled saline and AMP that ranged from 1.56 to 200 mg. The purpose of this experiment was to determine the upper limit of repeatability. This data was determined by two standard deviations of the relationship between sets of measurement and percent repeatability. The last treatment was a forced oscillation technique measurement. To perform this part, a 4 to 48 Hz noise signal, a bacterial filter mouthpiece, a nose clip, and a Sigma plot version 11 were required. The 4 to 48 Hz noise signal was put in the airway opening with a bacterial filter mouthpiece. It was important that the child was sitting straight up and the head was in a regular upright position. The nose was clipped into place and breathing was regular. The data was compared between healthy and unhealthy respiratory disease groups. To calculate data for each treatment, the Sigma plot version 11 was used, and the regular data was expressed by a mean value, while irregular data was expressed by a median value. Once treatments were completed and data were analyzed, the mean baseline ARS showed that children who have respiratory disease had lower z-scores at 6, 8, and 10 Hz. This table shows the ARS at 6, 8, and 10 Hz. ARS data is presented as medians of the 10th and 90th percentiles along with mean population z-scores plus or minus standard deviation for each group. Numbers were bolded to show the difference of baseline z-scores in healthy children. The bronchodilator test showed no statistical significance between healthy and unhealthy children who have respiratory diseases. For example, a healthy child had an RRS percent of negative 18.7 and a child with asthma had an RRS percent of negative 16. This table shows the percent differences in ARS, RRS, and XRS at 8 Hz after the bronchodilator. Bolded numbers show the difference of the healthy group by multiple linear regression. The AMP challenge provided data that showed ARS variables had a positive response when related to lower AMP concentration than RRS variables. This graph shows the bronchial provocation responses with AMP. The black bars represent the concentration of AMP related to RRS, and the striped bars also represent the concentration of AMP but related to ARS. The hypothesis that the ARS is a more effective way of detecting respiratory diseases than FOT variables was supported by the data because it provided detection of respiratory issues in young children. It was found that baseline ARS is helpful in detecting issues in children with respiratory issues and diseases. However, there was no major difference in bronchodilator tests between healthy children and children with respiratory diseases. Also, the percent ARS test was able to detect a positive response to AMP and allow for more insight on the differences of regular and irregular respiratory systems. Some implications could have arisen at the beginning of the experiment when baseline data for children was found. because unhealthy kids, meaning having respiratory issues, could just have had allergies or a cold that would have gone away in a week. Overall, this experiment could lead to further investigations on the benefit of using different types of tests to assess bronchial provocation with children.
Hello, my name is Julia Forster, and I will be presenting a scientific article that discusses if the short-term effects of air pollution are restricted to cardiorespiratory diseases. The short-term effects of air pollution are known to be commonly associated with health problems. Severe effects, such as respiratory diseases, are statistically less common, yet a frequent diagnosis. Mild effects such as headaches, conjunctivitis, or skin rash are most frequent, but data shows that within primary care, these effects are not frequently diagnosed due to poor indicators. In January 2009, researchers at the French Institute of Public Health explored links between daily levels of air pollution and medical home visits in Bordeaux, France. They questioned whether the short-term effects of air pollution restricted a subject to cardiorespiratory diseases. Researchers in the study expected that higher levels of pollution would increase the number of home visits regarding minor care. The goal of this experiment was to investigate the correlation between air pollution levels, nitrogen dioxide, ozone, and particulate matter, and the number of home visits made for minor medical reasons. To find data on the daily levels of nitrogen dioxide, particulate matter, and ozone, the local air quality network was used. Researchers used measurements from 4 background stations available within the study area because these locations are not influenced by sources of pollution. They chose locations away from major roads and industries in order to eliminate confounding variables. SOS is the primary emergency and healthcare network in France that provided the experiment with data on home medical visits by general practitioners. The data used from SOS came 60 practitioners who made more than 400 home visits per day. From this network, daily numbers of visits made to people living in the area reported in following complaints: upper and lower respiratory diseases, asthma, headache, conjunctivitis, and skin rash were recorded. Temperatures were measured in the Bordeaux station. Pollen counts were measured at the Bordeaux pollen monitoring station, and dates and holidays were obtained from the French Ministry of Education. The study was tested over a span of 7 years, and a total of 895,710 medical home visits were evaluated. Bordeaux, France, and 21 other neighboring cities were monitored daily on the local air quality, and a number of subjects were chosen and investigated based on their locations and complaint when being cared for at the medical facility. To compare the daily number of visits, lumbago visits was chosen as the control variable in order to avoid bias. Lumbago, which is lower back pain, was chosen because it is not associated with any of our chosen pollutants. For each air pollutant, data was analyzed through excess relative risk, ERR, to control confounding variables and trends, correlation coefficients to ensure accuracy, and confidence intervals to study the frequency within each estimate. Results included a positive and significant association between short-term effects of air pollution and the number of medical visits for headache, skin rash, and conjunctivitis. As seen in Figure 1, the daily number of visits made for headaches was significantly associated with the increases in nitrogen dioxide, particulate matter, and ozone levels. Skin rash or conjunctivitis was also increased during the increases in particulate matter and ozone levels. Figure 2 shows the results from specific age groups when compared to the relative risk of upper and lower respiratory diseases. Estimates of ERR were much higher in the elderly for respiratory diseases, upper and lower, regardless of the type of pollutant, suggesting a higher effect in this group. In the other age groups, effects were similar but not as dramatic. For asthma, no association was observed in children. After analyzing the data, our results conclude that health concerns regarding pollution is not restricted to cardiorespiratory sickness. The researchers' hypothesis was supported by the positive correlation found in minor health concerns when observing pollution. The study provides accurate and reliable data that can be used by medical experts or the general public in order to understand the association between certain health indicators and air pollution. The information found can help avoid poor diagnosis and improve precision. These results suggest that diagnosing only the severe effects of air pollution can lead to underestimation of the impact on public health. Being aware of all the potential health effects associated with air pollution is vital to improving the community's health. This information can be used to teach and educate other countries about the widespread minor health effects of air pollution. The end.